And what's up, guys? I guess it's been about a month, actually, to the date that I did my last update. And I just wanted to give an update on that patient that I talked about after the last video. So she comes back for her third treatment, and she said after the second treatment, she didn't do so well. And I was like, oh boy, what happened? So she said she actually she had nightmares. She actually dreamed and one night, like three of her most traumatic um, events in her life, and I was like, "Uh-oh, that doesn't sound good." So she said her sleep was actually kind of messed up again, back to like 2 hours, 2.5 hours, like she was before the first treatment. But she was still pretty optimistic, saying that her anxiety level, she was able to get it down with other things too, like yoga, meditation, some other techniques that she has, which is awesome. I think people should have multiple tools in their toolbox. So, anyways, I was kind of like, "Are you sure you want to do this third treatment?" She's like, "Let's go for it." So I'm like, "Okay, let's do it." And so when the fourth time she came back, this time, this was this past week, she's like, I was like, "How are you doing?" She's like, "Amazing. It was a miracle." I'm like, "What do you mean?" She said, "Well, I haven't had any symptoms since. I'm back to sleeping 8.5 hours. Been dealing with anxiety, or haven't been even dealing with anxiety anymore. Basically, when she thinks about her traumatic events in the past, she's like, it's like watching something on TV, like a recording of your childhood. Like you can see it and you kind of know that it happened, but there's none of that deep emotion that is there anymore." So I was like, "Wow, okay, that's phenomenal." And so she's like, "Yeah," and the effect has basically it's been persistent. And I'm like, "Amazing." So I guess I'm hesitant to say that she's cured, but I could say she's doing super well. And she almost didn't want to come back for another treatment. So we actually ended up treating something else completely unrelated for that treatment. We didn't even focus on the PTSD anymore. So, anyways, I think I am super encouraged again by the PTSD protocol. And interestingly, I had another patient tell me later on that unrelated to her, that she read up somewhere that PTSD seems to be one of the best things that FSM is for. So I will continue to use it for PTSD. I am hoping at some point I'm going to get a lot better results with some of my pain patients, neuropathy patients, things like that. So I would love to get better at that, and so I will keep working. I know it may take months, it may take years, but I feel like I seen enough, heard enough, and part of the Facebook group I'm part of, I know there's people getting good results out there. So I just have to dedicate myself more to it, to practicing more, to learning more, maybe through a little bit of trial and error of which frequencies will do best for certain conditions. And so I just gotta learn better. Anyways, I'm super excited to give that update, and my next update I'm gonna actually post is about me treating my own neck. Actually, it was a compilation over basically 3 days. I strained my neck, and so I will post that next. Okay, until the next update. See you guys.